Good morning. I am Ömer Bayrak from University of Gaziantep in Turkey. I am no disclosure. In our study, we aim to compare the efficacy of the cold knife ureterotomy versus laser ureterotomy in endoscopic surgery of the urethral strictures. A total of the 171 patients who underwent endoscopic surgery for the strictures between 2010 and 2018 were evaluated retrospectively in our study. Since laser was not used in the clinic our clinic for the urethral strictures until 2015, the patients were only treated with the cold knife ureterotomy. And after the 2015, many of the patients underwent laser ureterotomy. In our study, in patients who underwent urethral surgery or urethral dilatation under 14 years of age, had a urethral stricture longer than 2 centimeters, and who did not have to have 1 year regular follow-ups were excluded from the study. 53 patients underwent cold knife, and the 65 patients underwent a laser ureterotomy in our study who had completed data. And both groups were compared in terms of length of stricture, operation time, pre-operative and post-operative Qmax values, recurrence, and the presence of the complications. And the Qmax values lower than the 10 mm/second were accepted as the recurrence. In our results, no significance was observed between the groups in terms of the age, etiology, stricture location, and the mean stricture length. But the operation time was found to be shorter in patients who underwent cold knife. In addition, no difference was observed between the groups for preoperative Qmax values, but the Qmax values in the postoperative at 3rd, 6th, and the 12th month were higher in the patients underwent laser. And at the 1 year follow-up, the recurrence was determined in approximately half of the patients underwent cold knife, and approximately 20% of the patients in laser ureterotomy group. And in the conclusion, our study showed that the laser ureterotomy technique had lower recurrence rate and better Qmax values, and both of the techniques are similar, effective. Had no serious complications, and both were found to be reliable. And after the increase in the number of studies performed on laser ureterotomy, we believe that this method can be performed more widely, and it will be more preferred. Thank you.
Does it mean that the cold knife ureterotomy is now in your museum of urology?
No. But in our decision, we saw that the recurrence rate is really lower for the primary patients or the patients who underwent surgeries, cold knife, or other open procedures. We think that laser has better results in our experience, because after the 2015 we used the laser, and most of time we prefer laser for the urethral strictures, and we saw that the recurrence rate really lower.
No, I take that, but what could I see then still as indications for cold knife ureterotomy?
Both of them have same indications. Yeah, I agree.
But then tell me what are still indications for cold knife ureterotomy, because otherwise I would put it in the museum and don't use it anymore.
No.
But what would be the indications then?
The indications is same.
But when will you use still the cold knife versus the laser, or will you?
It depends according to the surgeon's experience. I think, for example.
No, but in your department, you're still doing cold knife ureterotomies?
Yes, still we have used.
Why?
Why?
Well, I mean, maybe the answer to why is that, of course, this is an observational study.
Yes.
So it's possible there is bias in this study, which is why a randomized controlled trial is the highest level of evidence. So I suppose the other question we could ask is, do you have a plan to do a formal randomized controlled trial?
We planned a prospective randomized study for this because an observational and retrospective study. So bias is inevitable. I accept, but we planned a prospective study. So,
And what is the hypothesis for the laser being better than the cold knife?
because I think that it decreases the contraction of the urethral mucosa, and maybe the epithelialization is better than the urethrotomy, I think.
Well, we definitely have similar experience with stricture at the level of the neobladder neck after radical prostatectomy, where laser incision yields much better results than cold knife or hot knife incision.
But you don't know why.
No, but it's just some clinical evidence. Thank you.
Thank you.